Hi, I'm Dr. Les Rykiss, and today we're going to talk to you about a wonderful product from FOO that I like to use quite often. And that material is FOO's Beautifil Flow Plus FOO. The F00 means the material will not move at all unless you manipulate it. It's completely stackable. Today we're going to go through a step-by-step procedure restoring a Class 5 abfraction lesion with no anesthesia using a hard tissue laser and restoring with FOO's Beautifil Flow Plus F00. Beautifil Flow Plus does come in both the F00, again as I've indicated, there is zero slump in F00, and it also comes in F03 formulation, which allows a little more flowiness to the composite. It comes in both syringes and compules for your convenience. My preference is actually using the syringes. Beautifil Flow Plus is a geimer, and a geimer is something that releases certain ions that help to strengthen teeth, kill bacteria, and reduce sensitivity. Here we are demonstrating the restoration of a Class 5 restorative abfraction lesion, which usually occurs at or below the gingival margin. Now, traditionally, we would use either a retraction clamp with a rubber dam or retraction cord to push the gingival margin away from the abfraction lesion, but here we're going to demonstrate using a BioLase I+ hard tissue laser to perform both a gingivectomy as well as creating an optimal bonding surface. Starting with the gingivectomy, we are exposing the entire gingival-most portion of the abfraction. That is performed very, very simply with the I+. Minor gingivectomy complete. As you can see, the I+ has left the tissue without any hemorrhaging whatsoever, with a full clear field now to restore that abfraction. Now we can turn our attention to the dentin, and when an abfraction occurs, it usually leaves the fractured surface very, very shiny and not really that easy to bond to. So now what we're doing with the I+ is we are going to roughen up that surface by ablating it. The next step with our I+ is to change the pulse frequency to leave the surface even smoother but highly etched. Gingivectomy complete. Ablation of the abfraction surface complete. And now we turn our attention to the next step. We are now beveling the external enamel margin so that we get better contact with our bonding agent as well as our composite, better micromechanical retention into the enamel rods and the dentinal tubules. Typically, the next step in our restorative process is now to etch the dentin and enamel surfaces. However, when you use a BioLase I+, some practitioners prefer not to use any further etchant because of the highly bondable, mechanically etched, laser etched surface. However, here we are using a 37% phosphoric acid etchant. Placing the etchant over the dentin and enamel beveled surface, we're leaving it there for 15 to 20 seconds. The etchant will be rinsed off for no less than 25 to 30 seconds to ensure that all etchant is off the tooth, and we'll air dry it to leave it just slightly damp. With the slightly moist surface, now we are using our applicator to place a desensitizing agent of your choice. This gives the tooth the utmost ability to be without any sensitivity post-operatively. FOO has a wonderful bonding agent that can easily be used here. However, My choice was to use the Bisco All Bond Universal. I like to use a universal bonding agent to make sure that I get an optimal bond to laser etch dentin, which is different than using just an etchant and primer bond on a mechanically etched tooth. A thorough wetting of the etched enamel and dentin is performed with a microbrush, and we use 3 separate applications with 5 seconds in between. Here we are air thinning our first layer of bonding agent. One more application is performed with our microbrush, and then we'll air thin it one more time after waiting 5 seconds. We're now activating our bonding agent with curing light. Here we're using an LED curing light that will cure this bonding agent in 5 seconds. So now we're going to add our Beautifil Flow Plus FOO flowable composite. The beauty of Beautifil Flow Plus is that I can apply it to the tooth surface and manipulate it without it flowing to places I don't want it to go to. I am very much in control of where the material is placed and where it goes to. There are instruments on the market that will do exactly what an Explorer here does for me, but it's your choice as to which way you'd like to manipulate the flowable composite once you've placed it on the tooth. My choice is to use an Explorer, simply pulling the flowable composite FOO. It is very easy to adapt to margins just using the Explorer, and the material is not going to flow where you don't want it to go. We're going to go over the margins with the Explorer, pulling that composite to cover the margin. If we need to add a little bit more flowable, we can do so on top. And again, manipulate it with the tip of our Explorer in a way that is highly controlled and ensuring that we have very, very little finishing to do once we've cured the restoration. Because of the nature of Beautifil Flow Plus FOO, allowing us to manipulate the composite so easily without it flowing elsewhere, we now have placed the entire amount that we need to fill the abfraction lesion in one step, and now we're going to cure it for a minimum of 10 to 20 seconds, depending on what light you're using. Now we're moving on to finishing the restoration. So here I am with an aesthetic trimming burr number 4 with a nice point on it. We're going ahead and smoothing the enamel composite margin as well as all margins at the gingival area to ensure that they are very, very, very smooth. This is actually quite easy because there's usually very, very, very little flash because of the unflowing nature of the FOO formulation. Shofu is my choice for polishing the composite after we've used our aesthetic trimming burr, and I use the One Gloss PS disposable points. You can also get them in cups and wheels, but they leave the surface very, very shiny. After using our aesthetic trimming burr, I'll take a One Gloss point and I will start at my gingival margin or at the coronal margin, leaving a very, very, very smooth interface between the enamel and the flowable composite, and moving on to the gingival margin. Now finishing the rest of the restoration at the gingival margin, leaving that with a highly polished, super smooth junction between the dentin and the composite or any enamel that may be present. Now we'll use our polishing tip that'll leave the surface highly smooth. And there we have it. There is our restored Class 5 abfraction lesion using a hard tissue laser for minor gingivectomy as well as ablation of the tooth surface without any anesthesia, but restoring with Beautifil Flow Plus F00, which gives you the ultimate control to fill that lesion and have very little polishing afterwards. Let's go ahead and show you one more case, because it's all day, every day for Class 5 restorations with the same laser treatment and using Beautifil Flow Plus FOO as our composite of choice. Showing 4 teeth in a row with abfraction lesions in the second quadrant, we will now use our technique to restore all 4 of those teeth. Once again, using our I+ for a minor gingivectomy and then switching to a hard tissue ablation to leave our surface super smooth and laser etched. Total etch technique on all 4 teeth to ensure the best bondable surface possible. Placement of a universal bonding agent. Light curing with any light curing system. Here we're using an LED light. And there are our 4 final restorations, fully cured and fully polished. And that's our technique. That's how we restore Class 5 abfraction lesions in my practice. And I couldn't do it without Shofu's Beautifil Flow Plus FOO. Thanks for watching.